I'm Jennifer Tesmer-Tuck, an OBGYN with the Office of Clinical Integration at North Memorial Healthcare. I'm here today with my colleagues Becky Cooper, a labor and delivery nurse, and Jack Hall, a scrub technician. Today we're going to demonstrate how to do quantified blood loss during a cesarean delivery. There are two important things to remember about quantified blood loss. The first is that we're not looking for a perfect, precise measurement. Instead, we're looking for something that's better than what we currently do, which is a visual estimated blood loss. The problem with visually estimating blood loss is that it's been shown to underestimate actual blood loss by 33 to 50%. And for patients who have a hemorrhage or lose more than 1,000 mils of blood loss, it's particularly bad to estimate. The second important thing to remember about quantified blood loss is that it has two components, a volume or measured component from the suction canister and a mass or a weighed component that comes from weighing any blood-soaked items in the delivery, such as sponges or towels. Now we'll go ahead and proceed with our delivery. During a cesarean delivery, most of your blood loss occurs after delivery of the baby and after delivery of the placenta. Before delivery of the baby, most of the volume that you get out of the C-section drape and in the suction canister is amniotic fluid volume and maybe some peritoneal fluid volume. So I'm going to want my team to help remind me after I deliver the baby that we want to check the suction canister. Becky, Jack, will you please help remind me after baby delivery that we're going to check the suction canister for amniotic fluid volume? Thanks. We'll go ahead and deliver. While I'm delivering, Jack is being careful to collect as much volume as he can from the C-section drape into the suction canister. I'll clamp and cut the cord and hand the baby off to the pediatrics team. At this point, we'll be sure that we've collected all of our fluid from the C-section drape, and then we're ready to look at our volume in the suction canister.
Okay.
Becky, would you go ahead and check the suction canister for us for the amniotic fluid volume?
Sure. It looks like our fluid volume is right at about 300.
Okay, so Becky, Jack, will you please help remind me at the end of the case to subtract that 300 off from our total quantified blood loss?
Yes.
Okay, so now you really have two methods to continue with your quantified blood loss. The first is to continue to take your blood volume into the same canister, remembering at the end of the case we're going to subtract the 300 mils of amniotic fluid volume off of our total volume in the canister. The second method is to ask your circulating nurse to switch the suction tubing from the first canister to the second canister. In that way, the first canister is mostly amniotic fluid volume, the second canister is mostly blood. In this case, Becky and I are going to continue with just the single canister method. So once we've checked our amniotic fluid volume, I'm going to proceed with the rest of the delivery. Go ahead and deliver my placenta. Take care of any ongoing blood loss that we have. Close the uterus. When I'm sure the patient is stable, most of her blood loss is completed, I'll make sure that we suction out the rest of the abdomen, suction out the rest of the drape, and then we're ready to complete our quantified blood loss calculation. Becky, Jack, we're about ready to close, and I'm about ready to do my irrigation. So it's probably time for us to check the suction canister again.
Okay. It looks like our total fluid volume right now is at 1,300.
Great, so if we take our 1,300 minus the 300 we had for amniotic fluid volume, our total volume for quantified blood loss is 1,000 mils.
Correct.
Everybody agree?
Yes.
Okay, it's the end of the case. We've closed the skin, and now we want to continue and finish our quantified blood loss with getting our weight of our soak sponges. Usually in the operating room, your circulating nurse and your scrub tech will have your sponges arranged in fives, and this is convenient for us because each lap sponge weighs 20 grams, so a pack of 5 is 100 grams. In this case, we have 2 packs of sponges, 10 lap sponges total, for a dry weight of 100 grams. Somewhere near your scale or posted in your operating room, you should have dry weights of any of the objects you might use to collect blood in the operating room. Lap sponges, pads, towels, anything that might soak blood. It's also convenient in the operating room if you have some sort of lap container like this lap sleeve. We could go ahead and weigh this entire thing together, provided we know the dry weight of the sleeve. In our case, that's also 20 grams. So we have 100, 100, and 20, so this entire package has a dry weight of 220 grams. Becky's now going to go ahead and do our wet weight of our sponges, and we'll show you how to calculate the actual quantified blood loss.
So first of all, we have a dry chucks pad on the scale, and just make sure that your scale is zeroed. And then we can go ahead and gather all of our sponge or labs and place them all on the scale. Find out what your weight is, and it looks like it's 474. We're going to subtract 200 for the dry weight count, so we have 274 as our blood loss.
Thanks, Becky. So 274 grams is the equivalent of 274 milliliters because 1 gram of blood loss is the same as 1 milliliter of blood loss. It's a nice one-to-one calculation. So now we take our 274 mils of weighed blood loss and we add that to our 1,000 mils of volume, and our total volume for this case is 1,274 mils of quantified blood loss. Quantified blood loss is a team project, so it's important before I leave the operating room that I communicate with my circulating nurse and the anesthesia team. One of these people is going to have to record the quantified blood loss in the medical record. Usually that's the anesthesia team. So we'll have a quick huddle, and I'll let the anesthesia team know that our quantified blood loss for this case was 1,274 mils, and that will be recorded in the INO flow sheet of the medical record. For most uncomplicated patients, you should continue quantified blood loss for the immediate postpartum period, approximately 2 to 4 hours. For patients who have a hemorrhage that's greater than a stage 1, meaning they've lost more than 1,000 mils of blood, you'll want to continue ongoing quantified blood loss. We therefore recommend that you train both your labor and delivery staff and your postpartum nursing staff on how to continue to measure quantified blood loss. Thank you for your attention and good luck with your quantified blood loss.